And welcome to the Dr. Bob Show. Everybody that I know wants to be healthy. What do they have to do to stay healthy? What do they have to do to get healthy? Are there certain things that they should look for, certain things that they should do, certain times of their life that they need to get certain testing done? We'll be spending most of this show talking about that. My guest is Dr. Dan Ely. Dr. Ely is on the staff at the University of Tennessee Medical Center. He's a board-certified internal medicine specialist, and he'll be answering our questions on getting healthy and staying healthy. Can't wait for his answers. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about COPD. Could people be getting COPD and not know it? Do you have to be a smoker before you can get COPD? New information may change your mind on that. And the effects of a good night's sleep or not sleeping well. If you're not sleeping well, then your health has a good chance of not being as good as it should be. So we'll talk about the importance of a good night's sleep. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Dan Ely, Associate Professor at the Medical Center at the University of Tennessee Medical Center, board certified internal medicine, and we're going to be talking about how to get healthy, how to stay healthy, what kind of plan is needed. Dan, welcome to the Dr. Bob Show.
Thanks, Bob. Great to be here.
I'm not sure what age we should start, but let's jump away from the pediatrician who's doing a good job bringing the children up to age 20. So from age 20 to 40, what do you feel we should be doing to instruct people in a health pattern?
Well, that's a good question, and I don't see kids, and I don't see many people less than age 18, maybe 16. But I think 20 is a good age for any young man or woman to think about getting in to see a doctor to start understanding some basic principles of good health. What kind of lifestyle measures should they be thinking about? What's important in their health? What testing might be appropriate?
So at age 20, they're young, they're healthy, they're vibrant. Nothing can conquer a 20-year-old. But there's some basic things you get. Blood pressure, blood sugar. What are some of the basic tests at age 20? And when you look across the table, what are you looking for?
Sure, that's a good question. And it might be different for different people. The main thing I want to know is, what do we need to think about this person's health? And for most kids, it's going to be a cholesterol panel, a lipid panel, and a blood sugar. That's probably all the testing they need, other than the blood pressure, the assessment of their BMI, their weight, for example, and then the lifestyle kinds of things. Are they active? Are they otherwise healthy? What about smoking, vaping, alcohol use?
So all of these things you address in a 20-year-old. You say, how much do you drink? How much do you plan to drink? What are your attitude toward drinking, smoking? Some of the vices of life that we know are detrimental to health.
Sure.
Yes. How receptive is a young person when you discuss that?
I think, interestingly, often they're pretty receptive. They're there for a reason. It's like I tell them, hey, you're paying me, so you might as well get your money's worth. Yeah. And hopefully they feel that we have a confidential relationship where they can express their concerns and also be honest about the things they're doing that they may simply want to understand better in terms of their health risks.
Yeah, and that's very important, because they may ask you something that they may feel uncomfortable asking somebody else. So if their blood pressure, what's the normal blood pressure?
Oh, normal is still considered in the 130 or maybe 140 range, over 80 or 90 or less. And for a young person, it really should be on the lower side.
So if their blood pressure is normal, their body mass index, you pay attention to that?
I do a lot. Now, I don't think it's a perfect indicator of fitness by any means, because you could be muscular and have a higher than kind of considered normal BMI, and that might be fine. But a BMI is the quickest way to assess for excess weight.
So if somebody is overweight, you look at them, they're overweight. There's no question about it. How do you guide that person? How do you counsel them?
Yeah, well, that's a great question, and that becomes tricky because there are multiple factors that go into that, why this person is overweight. First of all, I would try to understand what they know about it. Do they have a sense for what's gotten them to this position? It comes down to physical activity, dietary measures, and what they eat and how much they eat. Those are the primary things. There may be some other medical conditions that lead to that. Sleep apnea, not terribly common in a 20-year-old, but very common with age.
And there are things without sleep apnea that people can have abnormal sleep that leads to obesity and many health problems.
Absolutely.
So if you guide somebody toward good health, I like to jump to age 40 because I think at 40 the body begins to try to break down. So what are you looking for at age 40? What testing and what advice do you give somebody at age 40-ish?
Well, sure, and we're still going to talk about the same things that we talked about in the 20-year-old. What are you doing from a lifestyle standpoint? Are you physically active? Because that's so important. How are you eating? Are you eating too much? Alcohol use. And then we'll look more at things at blood work, although still lipids, cholesterol panel, and blood sugar are the keys, but I'll check kidney function for sure, and maybe blood counts if it seems appropriate, maybe a thyroid screen if it seems appropriate.
Yeah, so there are things that you can begin to think about. How's the thyroid? How's the metabolic function? What's their sleep pattern? What do they look like? How vibrant do they look when you're talking with them? Do all those things fit into your evaluation?
Absolutely, absolutely. And you'll get a sense of, and again, I keep coming back to the physical activity, but I think any activity is good, and it doesn't have to be competing in triathlons. It can be walking, it can be a variety of things, but regular physical activity is good, and more tends to be better.
So what do you tell somebody if they say, well, I'm active, I get out of bed and I do things during the day and I end up going to bed at nighttime, but they don't have a set pattern. Do you ask people to have a set pattern of activity?
If I think it's advantageous for them, yes. So I think if they're not overweight and if they're sleeping well, eating well, and don't have a set pattern of physical activity, I don't know that it's worth trying to change that, because sounds like it's working for them. But if it's not, if they're overweight, if they're tired, if they're not sleeping well, then I think we need to look at how we can change that.
Now, a lot of people just don't feel good. I just don't have the energy. What do you look for when somebody says, I'm just tired all the time, Dr. Ely? What do you think of?
Tired all the time is very common, and there's 100 causes, and it can be things like low blood counts, thyroid dysfunction, kidney liver dysfunction, sleep apnea, and other medical issues. But it's oftentimes related to lifestyle. They're not getting enough sleep, they're not getting good sleep, and they're not prioritizing their lifestyle to help them feel better.
Is that easy to pick up on? Sometimes yes, sometimes no.
I'd say sometimes yes and sometimes no.
Yeah. When you look across the table at somebody from your office, can people be too thin, look too undernourished, look too like they're training too hard?
They can. Of course, there are eating disorders in young women, but also in young men, and older men for that matter, but they're not as common in older men. Anorexia, bulimia, those tend to lead to being too thin with a body dysmorphic picture where they don't think they're too thin. Of course, people can be too thin because they don't eat well, don't eat enough, or have a medical condition that causes them to be too thin.
Every time they come see a doctor, do they get their blood pressure taken and their pulse and their height and their weight? All those things are important.
In our office, they get almost all that every time. It's not actually recommended that we do it every time, but certainly try to do it every year.
At age 40, when the body begins to fall apart, or age 40 to 60, are there some recommendations that we have to continue toward good health?
Yes.
And that's what we're going to be talking about. At age 40, or 45, or 50, what are the changes that we need to look for? Do we think about colonoscopy? Do we think about heart evaluation? Do we think about GI evaluation? And what do we need to think about to stay healthy? A lot of information. We're talking with Dr. Dan Ely, board-certified internal medicine specialist on the staff at the University of Tennessee Medical Center, associate professor. We've been talking about how to stay healthy. How do you know what kind of plan you need to stay healthy? What is your blood sugar? What is your cholesterol or your lipid profile? There are parameters of being healthy at an early age, and then we walked into age 40. Now there's certain times we need certain things done. Let's talk about colonoscopy. When do you recommend somebody have a colon exam?
That's a great question. And for the average risk person, meaning you don't have a first degree relative, parent or sibling with colon cancer, age 50 is kind of the magic age. That's when we start doing colonoscopy or colon cancer surveillance. And we may start talking about doing a PSA test for prostate cancer as well.
So PSA, prostate specific antigen, well, what does that tell you?
Well, that's just a marker. It's a protein that floats around in the bloodstream, secreted by the prostate, and it can go up if there's a cancer in the prostate, but it can go up if there's an enlarged prostate or an infected or inflamed prostate. So it's not a perfect test, but it's one that we should consider using at age 50, or 55 is probably the most common age too.
So we look for prostate cancers, we look for colon cancers, we're really looking for colon polyps because we can take those out that will eventually become cancerous.
Yes.
Do we look at the bones at this age? Do we look at any other type of special blood work?
Special blood work, I think I like to individualize that, because if you just do a panel of blood tests, you'll get answers, you'll get a lot of information back, but it may be confusing for an individual. But if they have signs or symptoms that are concerning, absolutely we'll do special blood work to look at joint disorders or thyroid we talked about before. We're always going to do that blood sugar periodically. We're always going to do the cholesterol panel periodically. And I look at kidney function regularly, as well as periodically liver function.
What are kidney functions?
Creatinine and BUN is another test, and what's called the GFR, or glomerular filtration rate. It's tough to say. It's just an estimate of how the kidneys filter the blood, and that's very important.
And so if those tests look abnormal, then you have to evaluate the urinary tract.
Exactly.
With testing. When you see a person that's overweight, not as active, their blood sugar may get a little high, their lousy cholesterol, the LDL, may be a little elevated. How do you get that person back on the track?
That's really important, really key, because the numbers are there, and what we try to focus on, what I do is the implications that may have for them. Do they understand that? Is that important to them? If it's not important to them, getting them back on track isn't going to be so easy. But if it does make a difference, if it does suggest to them that this is a time that we take stock in this, then I know that together we can work on a plan that should be helpful for them.
Where does the family history come into this? Well, people are living longer now, and it's important what mom and dad had as their illnesses to see if they're passed down. Where do you see family history?
Sure, family history is important. Doesn't always tell us the whole story, of course. And what we knew about mom and dad back then is probably not going to be as specific as what we would know now about an individual. But if your parents lived to ripe old ages, that's comforting. Doesn't mean you will, but we can hope that if you're following a good lifestyle, that'll help. And on the other hand, if you had early cancer or early cardiovascular disease in your family, we should think about what that means for you and how we can best avoid that.
So you look at the blood evaluation, you look at the patient, you look what's going on, and you have to set up, like, let's talk about smoking and alcohol. How do you advise people how much not to drink or to drink, and talk about smoking? We think, smoking's the evil of common society.
Well, sure. We'll talk about alcohol first. That's pretty simple, at least on the surface. Most authorities think that for a woman, 1 drink a day or less is reasonable, moderate alcohol consumption. For a man, 1 or 2 drinks a day or less. Now, of course, that means a 12-ounce beer 5 ounces of wine or 1.5 ounces of liquor. And if you're pouring your own drinks, and some beers now, all these craft beers have different levels of alcohol in them, it makes a difference. But those are probably reasonable levels for someone who isn't overweight and doesn't need to cut back on the calories there. Now, smoking, different. There's no reasonable level of cigarette smoking. And of course, now we're seeing all these complications from vaping. So we can't say that vaping is a safer alternative to tobacco use.
I look at vaping as having nicotine, and nicotine's addictive, and stop it.
Very much, very much addictive. Yes.
My analysis is pretty easy from that. How do you talk to somebody about sleep patterns?
Okay. I ask them how much they sleep, when they go to bed, when they wake up. Do they feel refreshed when they wake up? That's a real key. And I don't think there's a certain magic number they have to have of hours of sleep. For some people, it may be as little as 5 hours, but for most people, it's going to be 8 hours is a good round number. But do they feel good? Do they have enough energy during the day? Do they feel like napping during the day? Those are all keys. And then, of course, does somebody notice that they snore constantly, that they quit breathing at night? Those are concerns for sleep apnea.
So if somebody has sleep apnea, it harms health in other ways?
Absolutely. Sleep apnea is associated with high blood pressure, cardiovascular disease in general, and excess weight. And we don't know too much about the benefits of treating sleep apnea, but we do think it helps the blood pressure and a program of weight loss.
Yeah, it seems like we're learning more and more about the importance of a good night's sleep and how to sleep and what it takes to get a good night's sleep. Mm-hmm. So you need to be sleeping well, you need to be exercising. What about foods you eat?
Well, there's a million diets out there, as you know, and it's so confusing for people. But I think that in a simple way, you need to eat a variety of things, mostly fresh things, fresh fruits and vegetables. Avoid processed foods as much as possible. Meats in smaller quantities, okay. I'm an olive oil lover, so I think that's good, but some people would say that you don't want to do too much olive oil or fats in general. But fresh fruits, vegetables, nuts, whole grain breads and cereals and things, and not too much of them.
How about relative starvation? There's a lot of information about eating at a set time and trying to make 12 hours without any food. So eat at 8 o'clock, don't eat till 8 o'clock the next morning. Do you go along with them?
I do. However, I kind of do that myself naturally. And I would say that the data we have that supports it is not robust. I think there is some data to support it. I think what I really try to do is have people think in terms of you don't necessarily need to eat 3 meals a day. And I think metabolically, the body can benefit from periods of time when it's having to fast. After all, historically, that was common in the past.
Yeah. Dan Ely, takes guidance to stay healthy and to be healthy. I think it takes a good communication with you and your physician. Thank you for being such a good doctor and teaching us on the Dr. Bob Show.
Bob, I'm delighted to be here. Thank you.
A lot of information. If we can follow what's just been said, our chances of being healthier, happier, and living a better life will be better. Now you're going to want to stay tuned. We'll talk about, could you be having COPD and never been a smoker? Yeah, it could be. And we'll look at other ways to make sure that you can stay healthy. I want to thank Dr. Dan Ely. Wonderful discussion on staying healthy and getting healthy. Now, questions from you, the viewer, that I think will be important to your health. Question number 1. Dr. Bob, could you explain COPD? That's chronic obstructive pulmonary disease. We used to think of COPD as somebody that smoked half a pack, then a pack, then a pack and a half of cigarettes a day, and the cigarettes would damage the lungs and they would cause some scarring in the lungs, and they would cause some air trapping in the lungs, and that we would end up having increased incidence of cancer of the lungs and bronchitis, and a lung death. Now we know there's more to the picture than that. There are some people that don't have to be smokers that can develop COPD. So let's look at the lungs. As we breathe in air, the air goes down into the bronchial tree, into little air sacs. And the lining of the lungs and those air sacs are protected by certain cells that are in there, mucus secreting cells that will grab up pollution that we breathe in and will help milk it up toward the top of the airway. There are protective defense mechanisms in the lungs to keep us from getting bronchitis and inflammation in the airway. But when we look at the world that we live in, we see that there are increased times of poor air quality, where there's sulfur dioxide, where there are different products in the air that actually harm the normal lining of the lungs. So what we see is in people as they get to be age 40, that there is a steady decline in their lung functions. So every year the lung functions will go down a little bit. If somebody is in an environment where there's lots of pollution, lots of smoke, lots of things that are damaging to the lungs, in traffic where there's a lot of byproducts of automobiles and of society, then it may be that that decline is a little bit more rapid. And by age 60 or 65, when we have lung studies, the lung studies may say, hey, we've got some damage in your lungs. We need to be sure that we spend some time talking about that. Because there are medications that can help people that have COPD. We used to think it was irreversible, that the damage was there and we couldn't improve it. But now we know there are medicines, inhaled cortisone medications, that can help against the continued inflammation in the airway. So people can get COPD and not have been smokers, but it has a lot to do with the society in which we live. How do we find out? Go to our doctor and say, how are my lungs? I'd like to have spirometry. Spirometry will give you computerized analysis of how your lungs are, and will tell you if you have COPD, if your lungs don't expand well enough, or if our breathing pattern is not good enough. Question number 2, Dr. Bob, does poor sleep cause poor health? Well, it really, really does. So let's talk about some of the problems that we have with sleep and poor health. If somebody is chronically not sleeping well because of pain, because of noise, because of unusual hours that they're trying to go to sleep, then the body spends some time trying to protect itself. And the adrenal glands will begin to put out hormones to protect the body. But in order to protect the body, some of the chemicals that are put out by our adrenal gland cause the blood vessels to become a little bit more firm, cause our blood pressure to go up a little bit, cause our blood sugar to go up a little bit. We become pre-diabetic sometimes. As sleep is bad because of snoring, and snoring can make somebody else where they don't sleep good, but obstructive sleep apnea. If people are big-time loud snorers and snore every night, and they're chronic snorers, and frequently their snoring pattern will stop breathing as the throat falls back against itself. And there'll be periods of up to 10 seconds, 20 seconds, 30 seconds, even 45 seconds where people are not breathing. During that period of time, there's an oxygen debt. The brain recognizes that it's not getting the oxygen it needs. And when it does, it goes down to our adrenal glands and says, hey, something's happened, wake up. And so the body wakes up with a jerk and we begin to breathe properly. That's dangerous. Obstructive sleep apnea is dangerous. And if you know somebody that's snoring, that's stopping breathing, be sure they see a sleep specialist. There's a CPAP. There are masks that we can wear that will push the air past that obstruction and will relieve the situation and the problems that we have with a poor night's sleep. Now, there's lots of other things that cause a poor night's sleep. The room may not be dark, it may not be quiet, the covers may not be proper. There may be all sorts of lights. There may be activity that you do before you go to bed. So nighttime should be a time that you begin to look forward to and that you protect yourself. So you begin to slow down. So you take a hot bath. So you relax before you go to bed. So the room is nice and dark and the covers are the way you want them to be. And you begin to slowly drift off. Now, you need to know your medicines that you take before you go to bed. You need to know if pain is keeping you awake. So there's lots and lots of things that can make sleep difficulty. If you're having problems and you know you're not resting well, talk that over with your doctor or have you see a sleep specialist. All the time that we have for this show, remember those 4 things that we like. Number 1 is exercise. The more you exercise, the better your health's going to be. It's going to bring down your blood pressure. It's going to make you feel better. It will create chemicals in the body that will allow metabolism to be better. Eat less, be more active. So eat fruits and fibers. So start the day off with a good breakfast. A breakfast that's not too large, but not small. And then as the day goes on, eat less and less. Try not to eat for at least 3 hours before you go to bed. Be sure that you're getting your adequate sleep, 7.5 hours hopefully, and be sure that you're sleeping well. And most of all, what is it we like in the Dr. Bob Show? What's that laughter in your life? Find a way that you can be happy, that you can laugh a lot. If you laugh a lot, you'll be more productive. The people around you will be healthier. Life will be better, and you will stay healthier.